4.5 weeks, a transvaginal probe will be able to pick up a growing embryo. Now, transvaginal probes also are very, very important when you are looking at follicular tracking. Right? You may not be able to do a good job with transabdominal probe when you want to track the follicles, but with transvaginal probe you can do wonderful job when it comes to follicular tracking. And then other examinations that you will be able, other pelvic examinations that you'll be able to do with your transabdominal probe, you will be also able to do with your transvaginal probe, but this time with clearer and better resolution. So it makes it easier for the sonographer or the radiologist to to study the structures within the area that is being imaged or scanned.
Okay, thank you very much, sir. Sir, please, we want to know the difference between pelvic scan, pregnancy scan, abdominal scan, and the abdominal pelvic scan.
Alright, pelvic scan, abdominal pelvic scan, pregnancy scan. Alright, abdominal scan is a scan of the abdomen. Right, basically you are looking at the abdominal region. You want to look at the abdominal organs, the liver, the liver, the gallbladder, the stomach, the kidneys, the spleen, the bowels, large and small bowels. Okay, and then you also want to look at retroperitoneal structures. You want to see if a patient comes down with acute abdominal pain, you want to see if there is ascites, if there is any collection of fluid outside the bowel, gathering within the peritoneal region. You want to also see if there is peritonitis. You want to see the peristaltic movement of the bowel. Right? All these are what you view when it comes to abdominal examination. Okay. Now, when you come to the pelvic examination, we are looking at the pelvic region. Okay. For a male, basically what you want to look at is you want to look at the bladder, you want to look at the prostate. For a woman, you want to look at the bladder, you want to look at the uterus, you want to look at the ovaries, basically, and then adjoining structures, the adnexals. Right. Now, these are the things you want to look at when you do a pelvic examination. Right. Now, this is a pelvic examination that focuses on these structures I just mentioned, and the earlier one I mentioned was the abdominal examination. Now, when we combine these two examinations, we are having an abdominal pelvic examination. So if a patient comes down and then you want to run an abdominal pelvic examination, it means you are going to do an abdominal and a pelvic examination for the patient. Alright, but for a pregnancy scan or a pregnancy examination, it is done on, of course, women that are pregnant or that are expectant. Alright, so a lady comes in with missed period over a period of time, and she wants to know, perhaps she had done a pregnancy test, PT, and it shows positive. She wants to confirm it ultrasonographically. Right? The process of doing the examination is also a pregnancy scan. Now, a woman that is has a baby that is growing, of course, needs to come around for assessment of the well-being of the patient, the fetus, right? Fetal well-being. So the process of also checking the baby and checking the monitoring and following up on the pregnancy is that process, or the examination is basically what we call pregnancy examination. So these are the differences between the four examinations we just covered.
Thank you very much, sir. Sir, at this time, we want to know where you are working. And can you tell us where you are working, sir?
Currently, I am practicing with Royal Image Diagnostics, located around Oretta Sherry axis. That is, as you move towards Igondo Yanoba, as you go towards a cartoon, right? So rare image diagnostic services, and this is the place that currently I am. Right?
Okay. Now, what is your last remark to people viewing this video?
Everybody needs to do ultrasound examination at one point or the other, right? For a woman, there is need for you to check yourself. As a lady, there is it is very very important that a lady does general check on herself from time to time, right? Ultrasound examination can do a lot of good, okay, as you check the pelvic region for a lady, right? With an ultrasound examination, if we're looking at a lady, ultrasound examination will be able to tell if there's, for example, a lady comes down with lower abdominal pain, okay, or even without any pain, she comes around for a routine check, pelvic routine check, okay, ultrasound examination will be able to help us know or help us suspect the presence of pelvic inflammatory disease, right, within the woman, right? There are some pointers that we'll see, and then we can say that we can query PID, and then the lady can go for a high vaginal swab examination, HVS, or urine MCS, to confirm what has been seen from ultrasound examination. So whether you're a male or a woman or a female, there is need for you to run ultrasound examination even when you're healthy. Okay, it is important that you check, do a whole body checkup, right? And ultrasound is going to help you do this. But if you're a male, you may say that there's no, because male now, guys are not very very inclined to checking themselves until they are down with disease and sickness. But even as a healthy male, it is important that you go around, check your liver, check your kidney, check your abdominal structures, see that everything is fine. And as you begin to clock 40, 45, 50 as a man, it is very very important that you do not miss prostate scan, right? So these examinations are very very important whether you are healthy or you are not. Okay, so I advise everyone out there to take time to check themselves, do routine checkup, all right, through any means, and also visit a scanning center or an ultrasound center to do a routine ultrasound examination. It will do a whole lot of good for the patient and for everyone.
Thank you very much, sir. We are glad to have you.
It's my pleasure.